There are a lot of controversies in the world. The euthanasia is one of them, and this is attracting the attention. This is the intentional ending of life of the people who are suffering incurable disease and painful disease at his or her request. Usually, it used to help people who are suffering terminal cancer, brain death, or general paralysis. However, euthanasia is prohibited by law in many countries because it has some problem on ethical and apprehensions. These are main conditions of euthanasia on Oregon State. The patient have incurable, progressive, and inoperable disease. The patient must have 6 months or less to live. They have to have severe traumatic injury. They must make two oral requests for assistance in dying and written request for assistance in dying. They must not have been influenced by depression. It's not suicide. The purpose of euthanasia must not be just to alleviate of pain and fear of death. The doctor have to agree, prescribe medicine, and carry out. The patient must wait for 15 days at least. The euthanasia usually is applied to terminal cancer because terminal cancer have a lot of intolerable symptoms. Terminal cancer has intolerable pain that medicine can't stop. Emotional instability and serious melancholia. Invariably, terminal cancer patients are gonna get addicted to morphine at the last. So they will have clouding consciousness and hallucination from morphine and get more in mouth. At the last, they are gonna die of hunger from not being able to absorb nutrition from infusion therapy. So I can say that euthanasia is most effective to remove their pain and die gradually. However, there are some reasons to oppose to euthanasia. There are a lot of problematic issues of euthanasia yet. Euthanasia is to be in danger of being abused, too criminal. There is capable of that doctors or nurses commit murder easily, or someone who related to patient may ask the doctor killing him or her with money. The criminal happened already in Japan. In the point of medical care, if patients choose euthanasia easily and too much, there is capable of hindering improvement of medical care. And in the religious side, it is suicide or not. It's really deep problem but it depends on the religion. And it it's being in danger of induced discrimination and murder. There is an example to kill people who have disability from birth. In the World War II, a lot of people has disability were killed by the Nazi Germany on the basis of theory of their euthanasia program from eugenics. Of course, they wouldn't desire death. However, if their family desired and persuade them, maybe they are gonna sign up to application of euthanasia of by myself. However, I totally agreed to euthanasia because when my grandmother suffered lung cancer, she looked like really sad and she was suffering really heavy pain and finally she got some serious melancholia and she always was afraid to death. At the time, I thought that people can't die easily instead of they are suffering to fatal disease. And if she is gonna get well after serious pain, I would say her to just put up with her serious pain. However, in the reality, the patient faced heavy pain and serious depressions. Instead of that, they have no future. Therefore, I think that law should allow patients to choose euthanasia. Of course, I never desire that problem happened, what I said. So we have to prepare of law of euthanasia and make organization of euthanasia to clear in the medical setting. And finally, we have to respect the patient wishes. Thank you.